Combat Medical is an innovative medical device development company. It has designed a new delivery system for chemotherapy in bladder cancer that significantly improves patients' outcomes and reduces recurrence rates. Bladder cancer is the seventh most common cancer, responsible for 150,000 deaths worldwide. It is one of the most expensive cancers to treat due to its high recurrence rate. Combat Medical has developed an innovative technology which specifically targets non-muscle invasive bladder cancer. Standard chemotherapy is delivered to patients via a catheter at room temperature. This has been demonstrated to be reasonably effective. However, due to the naturally impermeable characteristics of the bladder, the chemotherapy doesn't penetrate as effectively as it could through the bladder wall. Combined with variables such as treatment time and uncertain distribution of the chemotherapy throughout the bladder, this results in high recurrence rates for bladder cancer patients. The Combat BRS system recirculates the chemotherapy through a closed, dry external system using a standard three-way catheter. The catheter is easy for clinicians to insert and doesn't cause any additional patient discomfort. The chemotherapy is warmed to a constant set temperature between 42 and 44 degrees centigrade by an innovative patented aluminium heat exchanger. The Combat BRS heat exchanger accurately controls the temperature of the chemotherapy fluid delivered to the patient within 0.5 degrees centigrade. The chemotherapy is recirculated up to 4 times a minute around the system and bladder for 60 minutes. This active delivery mechanism ensures a uniform set temperature throughout the bladder wall, tissues, and cancer tumours. This optimizes chemotherapy distribution around the bladder. The synergistic effects of warming chemotherapy in bladder cancer has been shown to significantly improve the effectiveness of the treatment by up to 59% compared to chemotherapy delivered at room temperature. By increasing the temperature to 43 degrees centigrade, it increases the drug penetration through the bladder wall into the cancer and increases the cytotoxicity by up to 10 times, therefore killing the cancer more aggressively. More importantly, healthy cells are able to manage and dissipate the heat more effectively, and therefore they are better preserved. Due to the simplicity and ease of use, the Combat BRS system fits in with current clinical practices, so it won't substantially increase resources required or clinicians' time. At the end of the treatment, the BRS system also enables you to remove all the carcinogenic chemotherapy drug and dispose of it safely. Combat BRS's chemohypothermia delivery system, a new and innovative way of treating bladder cancer.